Welcome to today's deep dive on the earliest clues of liver failure. Quietly, day after day, your liver handles more than 600 essential tasks that keep you alive. Here's the unsettling reality: liver failure often creeps in so quietly that its signals are brushed off as routine aches and inconveniences. By the time the warnings become obvious, as much as 75% of liver function can already be compromised. In this episode, we'll uncover a comprehensive set of early warning signs that research shows about 85% of people overlook. These aren't minor nuisances, they're urgent SOS messages from your body, appearing before damage becomes irreversible. If you're new here, welcome to a community focused on practical, life-saving health insights. If this video brings you value, please tap the like button and subscribe so you don't miss upcoming content that could protect your health. Drop a comment to tell us where you're watching from. We love hearing from our worldwide family of health-minded viewers. Why is liver disease so treacherous? Because the liver's extraordinary capacity to regenerate can mask serious trouble. It may keep working well enough even while sustaining significant injury, delaying clear symptoms until late in the process. With that in mind, let's get into the earliest signals, beginning with the first: fatigue and weakness. 1. Red palms. A reddish discoloration of the palms, known as palmar erythema, can be an early clue that your liver is struggling to maintain proper hormone balance and vascular health. According to findings published in the Journal of Hepatic Medicine, palmar erythema is strongly linked to impaired liver function, often tied to disruptions in hormone metabolism and changes in blood flow. When the liver begins to falter, it loses efficiency in breaking down hormones like estrogen. This buildup in circulation causes small vessels in the hands to dilate, giving the palms their distinct red appearance. The redness most often develops at the fleshy pads near the base of the thumb and little finger, while the central palm and fingertips remain unaffected. The presentation is usually symmetrical, appearing on both hands, with a blotchy or mottled pattern rather than a solid, even color. The skin may feel slightly warmer in the affected zones, and the redness often intensifies during physical activity, exposure to heat, or even during heightened emotional states. Unlike temporary flushing that fades with rest, liver-related palmar erythema persists and does not disappear once you relax. This sign is particularly significant because it's visible, objective, and frequently develops at earlier stages of liver dysfunction. Noticing this subtle but consistent change in your hands can provide a crucial opportunity for timely medical evaluation and intervention. 2. Unexplained weight loss. If the numbers on the scale keep dropping without any changes in your eating habits or activity levels, it may be a warning that your liver is struggling to keep up with its vital responsibilities. According to findings published in the Journal of Clinical Nutrition, unexpected weight loss is often linked to muscle breakdown, impaired absorption of essential nutrients, and shifts in metabolism that drive the body into a dangerous spiral of nutritional decline. Liver disease disrupts weight regulation in ways that go far beyond reduced appetite. A damaged liver loses its ability to properly store and process proteins, fats, and carbohydrates, leading to poor nutrient absorption even when meals are adequate. At the same time, inflammation raises the body's energy requirements, while compromised liver function leaves the body unable to meet those demands through normal food processing. This weight loss is a distinct pattern. Instead of simply shedding fat, the body begins cannibalizing lean muscle tissue for energy when the liver can no longer manage glycogen storage effectively. This kind of muscle wasting can occur even when daily calorie intake appears normal, making the weight loss puzzling and alarming. Left unchecked, it creates a vicious cycle. Nutritional decline weakens the body's defenses and limits the resources needed for liver repair, which in turn accelerates further damage. 3. Mental confusion or forgetfulness. If you find yourself forgetting names you've always known, struggling with tasks that once felt simple, or experiencing sudden mood changes, the cause may not be everyday stress or normal aging. Instead, it could be a sign that toxins are building up in your system because your liver is no longer able to filter them out effectively. Medical studies on chronic liver conditions highlight hepatic encephalopathy as one of the most serious yet often overlooked complications of liver disease. Normally, the liver serves as the body's main detoxifier, clearing harmful byproducts such as ammonia before they can reach the brain. When liver function declines, this cleansing ability weakens, allowing ammonia and other toxins to accumulate in the bloodstream and eventually cross the blood-brain barrier. The impact on mental health and cognition can range from very subtle to dangerously severe. In the early phase, people may notice difficulty focusing, occasional memory lapses, irritability, or slight changes in motor control. Many describe it as feeling mentally cloudy or struggling to find the right words. As toxin buildup intensifies, the symptoms progress to more obvious confusion, disorientation, altered sleep patterns, and even personality shifts. What makes this particularly concerning is that these changes often appear slowly and are easy to dismiss as simple aging, when in reality, they may be the liver's warning that urgent medical attention is needed. 4. Easy bruising or bleeding. If small bumps leave behind unusually large bruises or tiny cuts take far too long to stop bleeding, it may be a sign that your liver is no longer producing the clotting factors your body depends on. Studies published in the International Journal of Hematology and Liver Function emphasize that prolonged bleeding and unexplained bruising are often among the earliest warning signals of liver trouble, yet they are frequently dismissed as nothing more than aging or simple clumsiness. The liver plays a central role in manufacturing proteins vital for coagulation, including fibrinogen, prothrombin, and several clotting factors. When liver function deteriorates, the synthesis of these proteins declines, leaving your blood less capable of forming stable clots when vessels are injured. As a result, even minor trauma can cause bleeding beneath the skin that appears out of proportion to the injury. The bruising pattern is usually distinctive. These marks are often larger, darker, and slower to fade compared to ordinary bruises, and they sometimes appear even when you can't recall any injury. Other red flags may include frequent nosebleeds, prolonged bleeding after dental care, or, in women, unusually heavy menstrual cycles. Such symptoms point to a significant compromise in the liver's ability to sustain normal clotting function, highlighting the urgency of paying attention to these changes. 5. Itchy skin or pruritus. When relentless itching takes over your body and no amount of scratching brings relief, it could be more than a simple skin condition. It may be your liver sending out a cry for help. Clinical studies in hepatology and dermatology highlight that one of the most underestimated symptoms of liver dysfunction is severe itching, triggered when bile salts accumulate in the skin as a result of disrupted bile flow. Normally, the liver processes bile smoothly, but when that process falters, these salts spill into the bloodstream and deposit in skin tissues. Once lodged in the skin, bile salts act as powerful irritants, producing a deep, burning itch that feels impossible to soothe. Unlike typical surface-level itching, liver-related pruritus is widespread, affecting large areas of the body, and carries an almost internal sensation. Many describe it as if something is crawling beneath their skin. The condition follows a recognizable pattern. It often starts subtly, intensifies over time, worsens during the night, and can seriously disrupt sleep. This type of itching is frequently mistaken for allergies, eczema, or other dermatological disorders. As a result, patients are often given treatments that fail to provide lasting relief, since the true problem isn't in the skin itself but in the impaired liver function driving the toxic buildup. 6. Swelling in legs and ankles. If your ankles begin to puff up like balloons and your legs feel unusually heavy, it may signal that the liver is no longer keeping fluids in proper balance. Studies reported in The Lancet highlight lower extremity edema as a key early warning sign, often driven by two problems: diminished albumin production and rising pressure within the portal venous system. Albumin, made by the liver, helps maintain oncotic pressure inside blood vessels, keeping fluid within the circulation instead of seeping into surrounding tissues. When liver function declines significantly, albumin levels fall and fluid more easily escapes the bloodstream. The swelling that follows has a characteristic pattern. It typically affects both legs in a symmetrical way, starts subtly, and gradually worsens over time. People often notice it most in the evening, along with sensations of tightness or heaviness. Pressing a finger into the swollen area may leave a temporary indentation, known as pitting edema, that takes seconds to fade. This finding often reflects broader systemic issues, including portal hypertension, which drives fluid out of blood vessels and into the abdominal cavity and lower limbs. 7. Yellowing of the eyes or skin, jaundice. If the whites of your eyes take on a yellow tint or your skin looks unusually golden, you're seeing one of the clearest warnings that the liver is in serious trouble. Evidence reported in leading medical journals, including the New England Journal of Medicine, shows that jaundice marks a critical stage of liver dysfunction that warrants urgent evaluation. Jaundice develops when the liver can no longer properly handle bilirubin, the yellow pigment normally processed and cleared through bile, allowing it to build up in the bloodstream and settle in tissues. The earliest changes are often subtle and easiest to spot in natural light: a faint yellowing of the sclera, the whites of the eyes, where even small rises in bilirubin become visible. As levels climb, discoloration spreads from the eyes to the skin, typically appearing first on the face and then extending elsewhere. What makes jaundice particularly important is that it reflects measurable liver impairment. The depth of the yellow hue often tracks with the degree of dysfunction, making it both a key diagnostic clue and a practical way to monitor disease progression over time. 8. Pale or clay-colored stools. A sudden shift in stool color can be a vital clue about your health. When bowel movements turn pale, clay-like, or grayish-white, it strongly suggests that bile is not reaching the intestines as it should. Under normal conditions, the brown hue of stool comes from bile pigments produced by the liver and delivered through the bile ducts. If liver function falters or those ducts are obstructed, this flow diminishes or stops, and the stool loses its typical color. This change reflects a significant disruption in liver physiology. Bilirubin, which should be excreted into the digestive tract, instead accumulating in the bloodstream. One reason this sign is so valuable for early detection is its clarity. Unlike nonspecific symptoms such as fatigue or appetite changes, the color difference is visually unmistakable. The transformation is often abrupt and striking. Pale or clay-colored stools frequently occur alongside fat malabsorption, leading to loose, greasy, foul-smelling stools that may float due to undigested fats. Recognizing this pattern promptly can point to urgent liver or biliary issues that require medical evaluation. 9. Dark urine. Your urine can act like a status light for your liver. When it shifts to a deep yellow, amber brown, or tea-like shade, it's signaling trouble in the body's bile handling system. In a healthy state, the liver processes bilirubin and sends it out through bile. When liver function falters, excess bilirubin spills into the bloodstream and is filtered into the urine, producing that characteristic dark coloration, an early marker that deserves prompt attention. This discoloration is not the same as the darker urine seen with simple dehydration. Liver-related changes typically appear as a brownish or tea-colored hue that doesn't noticeably lighten with increased fluid intake. The effect is often most obvious with the first urine of the morning and may come with a stronger, unusual odor. What makes this sign especially important is how it behaves over time. While dehydration clears quickly once you rehydrate, liver-driven darkening tends to persist and may gradually intensify. It can even precede more visible warnings like jaundice, offering a crucial window to act before the condition progresses. 10. Abdominal discomfort or pain. That dull, nagging ache beneath your right rib cage may seem trivial, but it can be the liver's way of sounding an alarm. Studies in hepatology note that discomfort in the right upper quadrant is a frequently missed early clue of liver inflammation or enlargement. The liver itself lacks pain receptors, which is why disease can advance quietly. Pain arises when an inflamed or enlarged liver stretches the thin, sensitive capsule that encases it. People often describe the sensation as a steady stitch, a deep ache, or lingering soreness just under the ribs on the right side. The location is fairly specific, right upper abdomen, sometimes radiating to the right shoulder or into the back. Intensity can range from a mild, persistent throb to sharper episodes that worsen with deep breaths or when lying on the right side. Because it mimics musculoskeletal strain or simple digestive upset, this sign is easy to dismiss. Yet liver-related pain commonly intensifies after alcohol or high-fat meals, and it may come with a sense of fullness or abdominal bloating, signals that warrant prompt medical attention. 11. Nausea and vomiting. That unsettled stomach may not be about what you ate, it could be your liver sounding an alarm. When the liver can't adequately clear wastes, those byproducts linger in the bloodstream and create a toxic internal environment your body tries to reject. Reports from leading liver health organizations note that this constellation of symptoms is often mistaken for routine digestive troubles, which delays the care you need. As toxins circulate, they stimulate the brain's centers that govern nausea and the urge to vomit. This isn't a fleeting bout of queasiness, it's a persistent, unexplained sick feeling that doesn't add up to an obvious cause. Liver-related nausea follows a recognizable pattern. It commonly feels worse upon waking, may come with a bitter or unpleasant taste, and often has little to do with when, or what, you last ate. Many people describe a steady, low-grade nausea interrupted by stronger waves, especially after meals rich in fat, which place greater demands on impaired liver function. Recognizing this pattern is crucial, because it points away from simple stomach issues and toward an underlying problem with detoxification. 12. Loss of appetite. When once beloved foods suddenly seem unappealing, it may be more than a passing mood, it can be one of the earliest signals that the liver is struggling to do its digestive work. The liver produces bile to emulsify fats and aid the absorption of key vitamins, and it helps regulate blood sugar while processing nutrients. As liver function declines, these tasks become disrupted, blunting normal hunger cues and dampening the desire to eat. What makes appetite loss particularly insidious is its slow, creeping onset. You might start serving smaller portions, feel full after just a few bites, or realize you're thinking about food less often. While that may seem harmless at first, it triggers a harmful loop. Eating less deprives the body of the building blocks needed for liver repair, which further weakens liver function and suppresses appetite even more. Many people also notice changes in taste and smell. Foods may seem off, oddly metallic, or provoke mild nausea, reinforcing the cycle of reduced intake at the very moment the liver most needs support. 13. Fatigue and weakness. That deep, Bone-level exhaustion you've been blaming on stress or getting older may actually be the liver's earliest distress signal. Clinical hepatology research consistently notes persistent fatigue as one of the first recognizable signs of liver dysfunction, yet it's also the one most often waved away. As liver performance declines, its ability to clear toxins from the bloodstream falters. Those circulating byproducts disrupt cellular energy production, leaving you chronically depleted. Liver-related fatigue doesn't behave like ordinary tiredness. It lingers despite adequate sleep, tends to intensify as the day wears on, and refuses to lift with rest. Many people chalk it up to a packed schedule or the passage of time, grabbing another hit of caffeine and pushing through, while missing a critical warning. Even modest reductions in the liver's detox capacity can allow enough toxin buildup to trigger profound, whole-body fatigue that touches every part of daily life. This isn't the usual end-of-day weariness. It's a level of weakness that turns simple tasks into heavy lifts, a relentless drag on focus, motivation, and physical stamina, often long before other liver symptoms come into view. These 13 warning signals are your liver's urgent cry for help, warning you that something serious may be unfolding long before the condition becomes irreversible. The sobering fact is that once liver disease is fully apparent, as much as 70% of your liver's capacity may already be lost. Yet here lies the hopeful message: the liver is one of the most resilient organs in the human body, with an extraordinary ability to repair and regenerate when supported properly. Each of these warning signs is not just a symptom, but a chance to act early, protect your health, and restore balance. What matters most is recognizing these red flags, taking timely steps, and partnering with healthcare professionals who understand the critical importance of liver health. Don't wait until multiple issues pile up, and don't overlook a single warning as if it stands alone. Your liver has been your silent guardian every day, carrying out more than 500 vital tasks to keep you alive, strong, and thriving. Now it's asking for your attention, your advocacy, and your commitment to seeking proper medical evaluation and treatment that could safeguard not only your liver but your entire life. If this video has brought clarity to these essential warning signs, type helpful in the comments. That small action inspires us to continue creating life-saving content. Don't forget to press the like button if this information serves you well, share it with someone who may need it, and subscribe for more science-backed health insights. Thank you for tuning in, and remember, your health is your most priceless treasure. And your liver deserves your care and protection right now.